We are recording.
Okay. Well, hi everyone. Thanks again for joining this info session. We are recording my talk and we will share it with those people who couldn't join. But then we stop recording and we can see you and have a QA session at the end. So please write down your questions to the end so we will have the time to go one by one. This is hard to reach population training program. My name is Ali Mirzazadeh. I'm a faculty epidemiologist here at UCSF, associate professor, and my home department is Epi Biostat department, but I work in the Global Health Science, Institute for Global Health Science at UCSF. I'm sure you have seen this, but a quick view of the what is hard to reach population training program. It's a program designed to train students and mentors for new methods for sampling, population size estimation, bias analysis, and engaging hard-to-reach population in different type of research, including behavior, social, and clinical research. Um, you may have question like, who are this hard-to-reach population program? Example of those would be people who use drug, inject drug, people who deal with some illegal or stigmatized behavior that it's hard to disclose, hard to identify, hard to see who are they and where they are. It could be people with immigrant status, people who deal with suicide, people who had a criminal history or incarceration history background, people who engage in sexual sex work, people who are gender minority, transgender, MSM, and so on. So you can think about this link all like a long list of people who may be not easy to reach and also engage in research and program activities. The application to this program is free, and those who accept the program, we provide stipend as they participate to students. We will be able to provide up to 5,000 to mentors. We will be able to provide 4,500 as to give them some time, like kind of open time for activities during this program. The format, we are based in San Francisco. We will have options to be in class online or to be in person when we have the sessions and courses and meetings. Um, Eligibility is so wide. Anyone who bachelor's degree and above, working in public health, have an topic on a hard-to-reach population, or they have experience, they are welcome to apply. This is the one of the info session. You can also see some key dates here. Application open since beginning of February. The end of this month, we close the application. We have 2 months to select the applicants and announce the results. And we start the course orientation day would be September 1st in a few months. The application is in our website, and that's the website and the email here. We also share the email at the end. This is the third year of we having a students. We call them cohorts. So cohort one enrolled last year. We had 9 students in the cohort one. 7 of them work on a paper on a hard-to-reach population. 2 of them work on project. We had also 3 mentors in our program. They work each with 3 students. We had 8 faculty also work with the mentors and the students. So this is a picture of most of the participants in cohort one, including me, Willie, and our team. We also have Maeve Foster, who is here with me, program manager, and then we have Ming, who is so he was a grant manager for us. So that was cohort one. Right now we are almost finishing cohort two coursework and projects. So they are going to present on 26 March. They're going to present their final results, what they achieve in the protocol or paper or proposal. And we will, I think, I asked this question that if you, people like you, want to participate in that Zoom presentation, you're welcome to join. So we will share that info when we get approval. And you can join that final presentation. That will be cool to see what examples of work they did during the Hard to Reach program. We have 11 students right now, and then we have five mentors to the program this year, and we have six faculty, including me, to the program to work with the mentors and students in cohort two. The schedule for the program, 1 day orientation. It's on September 1st. Then we have an intensive sampling course in September. We want to finish by mid-September, around that time. It will be including 10 sessions. Everyone required to join and attend the sampling course because it's provide the base of all the methods we want to talk about, hard to reach population methods. Then we have a 1 day workshop for our mentors who are accepted to the program. We continue on October to have 8 sessions on population size estimation. We highly encourage you to also attend this course. It's very innovative. It's going to open your thinking about what other approaches you can apply and use in your research for hard-to-reach population, but it's elective. It's 8 sessions. The bias analysis course is also elective. It's give you an idea how you can measure, quantify biases, and you can adjust those bias measurements to your study as well. It's going to be in November, not the week of Thanksgiving. So you're going to enjoy all the festive during Thanksgiving. Community engagement would be in December for session, and it's mandatory. It's part of the required how you can work, engage, build trust, and involve, recruit these people to your study. During this 4 months, you will start working with your mentors. And then after this 4 months of course, attending and meeting with your mentors, we also have 3 months focus on the last steps of your project, working with your mentors and faculty, and finish your project by March and present back to everyone. Our team, including me as a lead, we have also my mentor, Willie McFarlane. He is a professor at UCSF, working at San Francisco Public Health Department, leading a lot of HIV and community research in San Francisco. He is a director of the sampling course. Paul Wesson, who is a associate professor at UCSF, epidemiologist, graduate from UC Berkeley. He's going to lead the population size estimation course in this program. Tom Hoffman, who is a faculty biostatistician at UCSF, he's going to lead the quantitative bias analysis course. Sean Arya Sirikul, he is in UC Irvine now, but he has a lot of collaboration research with us. So he's going to lead the community-based participatory research course. All of us, including Wayne, Erin, Elizabeth, and other faculty who may have a good overlap with your interests or students in an accelerator program, they will be added as a faculty and mentor our students. And we have amazing support team. Maeve is here, and Ming also work with us. Who can apply? Almost anyone who's interested in a public health to work or research on a hard-to-reach population, they can apply. As a student, you can apply, or as a mentor. If your interest, job, status is required to supervise some people, or mentor some students, or teach a group of people for doing research or monitoring a program or implementing a program on a hard-to-reach population, you can apply as a mentor. It's justified. And as a student, you can be anyone who is interested to learn and expand your skills and then improve your experience with working with the hard-to-reach population. You can apply in track A or track B. Track A means you have you're working on your own project. Either during the program you build, draft a full application of your grant for a hard-to-reach population research, or you have your own project funded and you want to write an implementation protocol, or you want to bring your data from your study to the program and we help you. So that means track A, you're working on your project at any stage that project is in. Writing a grant, writing a protocol, writing a sampling protocol, or doing the data cleaning, doing the data analysis, or publishing from your project. Track B is giving an option for those who don't have right now a project to work on, but we will give them access to the databases that we have from past hard to reach projects. There could be studies here in SF, international, other partners. So we have those databases to be shared, and you can work on those and your interest. You can learn for doing the data analysis. You can learn about what this data, how this data has been collected, how this data is going to be analyzed, how it could be being reported as a paper, and we help you to publish your paper. This is our expectation. Participation means 7 months in the program. You're going to meet with your mentors and faculty during this program quite often. Um, at some time, you're going to meet weekly towards the end of the program to get done. From the start, when you have courses, it's going to be every 2 weeks. We expect that you complete the project. That could be a research proposal that you finish and ready to submit to a sponsor. It could be a sampling protocol or implementation protocol for your study, or it could be a data analysis that you've done with your mentors, and then you have all the tables, figures, and results ready for a paper that you will finish. Most of our students actually done the whole thing, so they provide the guidance, and then they finish the whole manuscript ready for submission. The mentors are required to be in the program for 7 months, meet with their students, attend the workshop for mentors, and collaborate monthly with our like progress follow-up and so on. So we have also a program for them to improve their mentoring skills. This is too busy, but I can summarize it for you. For the sampling course, you're going to know what are the hard-to-reach population, what are the sampling options according to enrolling them through networks, enrolling them through venues, enrolling them through more innovation areas like online spaces, and then how you can think about the sampling approaches, how they could be weighted in a way that resemble the random sampling approaches. If there's any clustering, how do you do that one? There will be 3 sessions, lab sessions as well, to complement your learning of these methods, how you deal with the data, how you deal with the weighted analysis, and how you can produce the outputs of that, including all the adjustments required for those sampling specific methods. The publisher size estimation is going to be what is this useful? What are the mapping methods, size estimation? What are the network scale up? Capture to capture, we have both lab and methods about this. We also have a lab for network scale up. We also have Bayesian tools, how you can do size estimation, combine the results, and produce the outputs from a synthesized basis approach. There would be 2 lab sessions to work with the data for this course. Quantitative bias analysis is going to introduce what are the biases, selection biases, confounding biases, information biases, and how those misclassification is going to be measured, and how you can do the analysis, quantify, and adjust the results based on those bias measures. The community-based engagement is going to be 4 sessions. It's going to how build trust, how engage community, some case studies about photo voices, and also how to maximize community input to your research to according to all the steps that you're going to do your study. We also have a newsletter. I'm leading this work, and we are putting new methods every month. We are sharing news, we are sharing achievements, we are sharing opportunities. And if you want to receive newsletters for this month and the coming months, please subscribe by going to this website or scan the barcode. So that is something you can be involved and engage in our, know more about the program and also other opportunities that we share in the newsletter. And this is how you can contact with us. Info session is just the start. So You can reach out by email to our program, email me, or visit our website. So all of those is available for you if you have any further questions or um, just anything about the program. So Maeve, I think I stop here. This is the last slide. So then we can maybe stop recording and then have see if there's any question for us.